I'm Paul Hemsil. I'm the founder of POMS, which is prescription only medication support, and I run this service covering the whole of Derby City. Just because it's prescribed and it's off a doctor doesn't mean it's any safer than what you take off the streets and stuff like that. So it's taken me 10 years to get POMS up and running, and working with public health and trying to convince public health that this is a serious problem that needs some serious backing. So I call the patient up, I introduce myself, ask them if they want to come in for a chat, just to explain more about the medication that they're prescribed. Any questions they've got, to write them down and bring them with them. And because I can allow time, I can go through any questions they've got. I sit down with them, explain what happened to me, what I was doing in a previous life before this, how I'd worked my way up to manufacturing, operations manager in manufacturing for the same company I'd worked 26 years for, and I'd put on this following a back injury. I lost it all. I lost that. I lost my relationship, and almost my life, not only through the amount of accidental overdoses that I took, but also nearly doing it myself when I felt let down by a system that should have helped me, that I paid into all my working life. And it's about getting to the patient, knowing the patient. I go through a presentation. This isn't to frighten them, and I explain this, but this is to explain everything that happened to me personally, physically and mentally, and then I backed it up with science and research. It doesn't mean it will happen to them, but the risks are increased. This is why I need to discuss and answer any questions that they might have about the medication. And at some point they all said, that's happening to me, but I didn't realise it could be the medication that's causing it. So then I give them some information on the medication that they are prescribed, and most of these people have agreed to come back and see me again. And one thing I find that a lot of them do say after that first appointment is, I'm telling you stuff I wouldn't dream of telling my doctor, because it's that fear, because it's like I've almost become their voice, where they feel like they've never had one before, because they can't. It's this overwhelming fear of de-prescribing. I'm taking all your medication. That's all it says. I'm taking your medication away, and it's not just a case of that. It's far more complex than that. It's about planting that seed. So even if they're not ready at that particular moment, it's about giving the information for them to read through it, to take away, and knowing that that support is there when and if they're ready to receive it. I link in now with social prescribers, with health and wellbeing coaches from Derby County Community Trust, pain groups. I work with the hospital pain clinic. So it's about bringing all services together for the sake of that patient, and trying to prevent and get them to where I did. But I think it's important that you've got the specialists, as in the treatment or addiction services, and you've got primary care. We're both in Derby, we're both working together to create that support, that wraparound care and support that's needed for the sake of the patient. Why should patients be forced to go somewhere else, use more dangerous substances than what they get prescribed, just to get the help? And just because it's a professional that says this is what's best for you, you have to listen to the patient. The only guidance you really need is sat in front of you and be led by that patient. I've got patients that aren't even on a substitute, that are doing really well and have come off stuff, because it's that personalised care and support that's been put in place for them. The costs, the knock-on added costs of, if we don't address this issue properly and before they get further down the line, the implications not just to people's physical health but the mental health as well, and the strain that's already on services, it's a massive cost saving. I could have died through respiratory depression caused by the medication. So that's without all the other consequences as well. Peripheral neuropathy, nerve damage in my feet caused by the pernicious anemia caused by all the medication. So it's all these knock-on effects that we need to address and make patients aware that this could happen long term if we carry on prescribing this medication. We need to put support in place across the whole of the UK. There's hundreds of thousands of people out there struggling, and we're not doing nowhere near enough. This support needs to be put in place, and it's not one service or another service. It's about all services coming together for the sake of the patient.